Continue on the discussions of a clinical trial. So we will start today about the lecture 3 and it will talks about the enzymes. So what they are enzymes? The enzymes are biocatalyst we can say, and most of them they are proteins. So most of the enzymes they are proteins, and we can say these enzymes are biocatalyst. The question is why we what do we mean by biocatalyst? Are the substances which speed up chemical reactions in the living organisms. Bio, that is referred to the biology. Catalyst, that's mean they catalyze the things, they make a catabolism, and that's mean they are speed up the chemical reactions in a living organism. This is the best definitions for the biocatalyst. So when they just ask what is the definitions of the enzymes, we can say it's a biocatalyst. Most of them they are proteins. What we mean exactly by the biocatalyst? That's mean they are speeding up the chemical reactions in the living organisms. Proteins because some of them are NA ribosomes. Okay, most enzymes are larger than substances that interact with, but the enzyme has a specific shape and bind to its active site. Actually, most of the enzymes they are larger the substrates because the enzyme bind or the active site of the enzyme bind to the substrate and then it speed up the chemical reaction. Most of them they are even larger than substrates, and we have many examples of these enzymes. We have a proteases, nucleases, amylases. So proteases that's mean break down proteins. Nucleases break down the nucleic acid. Amylases break down the carbohydrate. So each of them has a responsible, or we can say this its actions. Okay, so proteases, and from its name proteases, that's mean it's a break down the proteins. Nucleases, that's mean break down the nucleic acid, and then we have something is called amylases. Okay, now we talk about the other thing. These enzymes, for example, they are not bind, but they break down into the small pieces, and that is give us information that each enzymes or every enzyme had a specific work. Sometimes a breakdown, sometimes bind, all these things. But the summary of that, they are biocatalysts, which they are speed up the chemical reaction on the living organism. Now we're talking about the calcifications of the enzymes. The calcifications of the enzymes, the first calcification is called oxoreductase enzyme. One molecule is oxidase and the other is reductase. So oxoreductase enzyme, which is composed of oxidation and reduction, that's mean they are calcified as one. Okay, so EC that's mean enzyme calcification 1. So if we hear, for example, cytochrome oxidase, that's mean it's the calcifications is 1. Okay, or we can say, so we understand now that oxidase or reductase it's in the calcification of 1. But if we just mention enzyme like lactate dehydrogenase or glucose 6-phosphate dehydrogenase or alcohol dehydrogenase, once you hear dehydrogenase, you have to know that is also calcification 1. Okay, so the calcification 1, oxidoreductase, if you hear oxidase or you hear reductase, then you know 1. But if you hear dehydrogenase, is also 1. Okay, because there is oxidation and reduction in these reactions. So oxidase, reductase, dehydrogenase, it's the calcifications of 1. Now we go to the calcifications of 2, and that's mean a transfer, like we transfer the functional group from one to another. That's what I mean exactly by the transferase. When I say AST, that's mean asparatate aminotransferase. So it's 2. Alanine transferase, also 2. But when I say hexokinase, for example, hexokinase, it transfer the phosphatic group of substrate to the product. So kinase also it's a part of calcification 2, or classified as 2. Transmethylase, because we transfer the methyl group, so also it's calcification of 2. Also citrate synthase, trimethylylate synthase, also calcification 2, because there is a transfer of a group. Now we go to the calcifications 3. Hydrolysis, cleavage of bonds by addition of water. That's what we mean exactly by the hydrolysis, like we're making a cleavage of the covalent bonds by addition of the water. Actually, all the digestive enzymes are hydrolysis. Once we hear amylase, pepsin, trypsin, chymotrypsin, lipase, all they are under, or they are classified as 3 hydrolysis. So all the digestive enzymes, they are classified as hydrolysis. But when we hear acetylcholine esterase, it's also hydrolysis. Lactase, saccharase, urease, peptidase, ATPase, ribonuclease, phosphodiesterase. We just focus on these enzymes. All they are classified as hydrolysis because they break down the covalent bond by the addition of the water. Now we go to the calcification 4, which is non-lyases, like aldolase, fumarase, arginosuccinase, carbonic anhydrase, HMGCO lyase. Okay, anything end with the A is, but it's not a rule. Okay, so we can say it's lyases or classified as 4. So examples for that, it's like remove a group or add a group to the double bond, but the examples of that like aldase, fumarase, arginosuccinase, carbonic anhydrase, HMGCO lyase, all they are under the lyases. Now calcification 5, it's isomerases, converting one isomer into the another, and we have example like phosphoryl aromatase, triphosphate isomerase, phosphohexose isomerase. So they are 5. Okay, and then 6 ligases, like bind the like binding, and everything it with the synthetase, not synthetase, then it's ligases, like glutamine synthetase, pyruvate carboxylase, DNA ligases, PRPP synthetase, DNA polymerase, acetyl coenzyme A carboxylase. They are under the synthetase enzyme, so we can say it's calcified as 6, and which is called ligases. And then we end with the translocases, and the translocases is facilitate movements of molecules or ions or anything across the cellular membrane, and the example of that is ATP synthetase enzyme. So that about the calcifications of the enzymes. So 1 oxidase reductase, 2 transferase, 3 hydrolase, 4 lyase, 5 isomerase, 6 ligase, 7 translocase. And then with the, for example, we have the creatine, and then creatine kinase, because we know that it uses ATP, take the phosphatic group and add it to the creatine, so we can say phosphocreatine. So kinase is classified as 2 because it transfers the phosphatic group from the substrate to the product. Then we talk about something is called isoenzymes or isozymes. They are multiple form of the enzymes. Like we have enzyme, okay, and it has a multiple forms of the enzymes arising from genetically determined differences in primary structures. Isoenzymes may occur in a single organ or even within a single type of the cells, maybe in one organ, or maybe it occurs with a single type of the cells. Okay, so it's a broad term covering all the proteins catalyzing the same reaction. When I said multiple form of the enzymes, I'm not talking about one enzyme that has multiple types and we can say it's isoenzymes or isozymes, but I'm talking about the multiple form of the enzymes. Like we have different type of the enzymes and they are catalyzing the same reaction. It can maybe occur in the single organism. So the first enzyme, which is known as lactate dehydrogenase enzyme. So from its name, lactate dehydrogenase enzyme, so it is classified as 1 because under the group of oxidoreductase enzyme, because we said oxidoreductase enzyme, if we hear oxidase reductase dehydrogenase, then it will be classified as 1. And from its name, like we said, lactate, so it starts with the lactate plus NAD positive, it will end to the pyruvate plus NADH plus H positive, and it's reversible reactions because it can go in the both directions. And some said that's a pyruvate, or that's maybe logically that this can maybe happen in the aerobic reaction. To understand it, like we wanted to know this reaction, I'm talking about this reaction, how it's important in the normal thing, that's mean in the presence of oxygen, or we can say it's aerobic. We have a pyruvate, and then by TCA I mean the tricyclic, and that is lead to the production of ATP, CO2 and H2O, I mean water. But that is happening in the aerobic reaction, that's mean in the presence of oxygen. If there is absence of oxygen, then this reaction will happen. It will start with the pyruvate, NADH and H positive. By the help of the lactate dehydrogenase, that is lead to the productions of lactate plus NAD positive plus little amount of the ATP. So I will talk some information about the lactate dehydrogenase enzyme. The first thing, that is a presence in the systole of the cells. It's more, it's a presence in the serum. Maybe we can say 1000 folds in the serum. So it's a presence in the systoles of the cells more than a presence in the serum. And about its structure, it's tetrameric enzyme that is formed of the 4 peptide chains of 2 types. So when I say tetrameric enzyme, that's mean it composed of the 4 subunits of 4 peptide bonds. And these subunits, they are concerned, or they are 2 types with the 5 major isoenzymes. These are the isoenzyme that I will talk about it. So there will be 5 major isoenzymes, like multiple form of the lactate dehydrogenase. Each isoenzyme has different sensitivity to the temperature. Like for example, lactate dehydrogenase 4 and lactate dehydrogenase 5 are unstable and their reduced activity in -20 Celsius, that they are unstable. So each isoenzyme has a specific character, has a specific sensitivity to the temperature, to the humidity, to the other environmental conditions, and each one is specific for organ, for example. About the variability, because the different tissue produces different types of the lactate dehydrogenase, that's what we'll discuss it later, so that it made more specific. to show us this lactate dehydrogenase enzyme from which it comes. Non-hemolyzed serum is the best specimen for the lactate dehydrogenase activity. Actually, hemolysis is not good for any serum to measure anything, actually, not only the lactate dehydrogenase enzyme. But the question is, the lactate dehydrogenase enzyme, it's increasing when it happen a cell damage, because we know that the lactate dehydrogenase enzyme that is present in the systole of the cell, and then when it happen damage to this cell, that lead to increase the release, like this damage to the cell, so the lactate dehydrogenase release to the serum, and that is happen in many conditions like stroke, heart attack, liver damage, hemolysis like lymphoid tumor, kidney failure, pancreatitis, and any disease that is causes damage to the cell, that is increasing the lactate dehydrogenase enzyme. About, we can say about the presence of the lactate dehydrogenase. Actually, while I'm searching on the multiple sources where actually we have the lactate dehydrogenase, or we have 5 isomers of the lactate dehydrogenase, but the sources they are differ about the presence of it. Like here we said the lactate dehydrogenase 1 is a presence in the heart, lactate dehydrogenase 2 that is a presence on the RBCs and the kidney, lactate dehydrogenase 3 that is present in a spleen, in a lung, in a thrombocyte, in the lymphocyte, 4 in a pancreas, 5 in the liver and the skeletal muscle. But some sources they are said, for example, heart that is a presence in 1 and 2. Okay, RPCs that is a presence in 1. Yeah, some resources and most of the resources they are said the lactate dehydrogenase 1 that is a presence in the RPCs, in the only RPCs, not only the RPCs, because we said that the heart that is present in the LDH1 and LDH2, but more abundant in the lactate dehydrogenase 2. For all the lactate dehydrogenase isomers are elevated. If you just make a measurement of the sample and you find that all the lactate dehydrogenase enzyme are elevated, that means this organism has gone to multiple organ failure. That means there is a multiple organ failure, so that is lead to something like that, and that is biologic, because we know that each lactate dehydrogenase or each isoenzyme comes from different tissue. And when will happen the multiple organ failure, that is can maybe happen in myocardial infarction, systemic lupus erythematosus, in a cancer, eclampsia, all these conditions. And we have one example. If the patient said, I have a central chest pain but since 4 days, so you think that is a myocardial infarction, but it's delayed because he said since 4 days. So it will be helpful in this time to measure the lactate dehydrogenase, which type, maybe 1 or 2. But the most important thing is lactate dehydrogenase 1 in these conditions, because it normally comes from the lactate dehydrogenase 2. But when you elevate it, or when you find that the lactate dehydrogenase 1 is also elevated, which is normally it's not elevated, then that's mean the patient has myocardial infarction. And we can measure it by the ratio lactate dehydrogenase 1 divided by the lactate dehydrogenase 2. So if it's more than 1, that's mean the lactate dehydrogenase 1 is more than the lactate dehydrogenase 2, and that indicate that the patient has myocardial infarction. Also, if that is happen as extravascular hemolysis, for example, if we have a spleen macrophages, and that's an important to understand it. So splenic macrophages, that digest the RBCs, and then the RBCs, after the digestions, then the lactate dehydrogenase inside these RBCs will go out, and the RBCs contain lactate dehydrogenase 1, not 2. Okay, it's 1, not 2. It's a source, that's from our lectures, but many sources, and I'm really honest that many sources said that the lactate dehydrogenase 1 that is present on the RBCs and not on the heart. So the splenic macrophages eat the RBCs, so that is lead to the spread of the lactate dehydrogenase 1 and also the hemoglobin. So the lactate dehydrogenase 1, it changes the pyruvate into the lactate, as we see from the previous reaction, and also lead to the for hemoglobin, release of hemoglobin composed of hemoglobin, heme composed of iron, protoporphyrin, and the protoporphyrin that is lead to the unconjugated bilirubin, and by this way that is lead to the formation of the bilirubin by the hemolysis. But this is not our topic. The important about this our topic, that is by the hemolysis, that's mean we are destructed the RBCs, so that is lead to the release of the lactate dehydrogenase 1 and not 2, because the lactate dehydrogenase 1 present in the RBCs. Then we have also the haptoglobin. We will discuss also it later. It will be also decreased in the hemolysis. So in the case of the hemolysis, the lactate dehydrogenase 1 increasing, exercises that is lead to the increased lactate dehydrogenase 1 because of RBCs, because not any exercise like a strenuous exercise, and an increase of the lactate dehydrogenase 2 because it's referred to the heart, and an increased lactate dehydrogenase 5 because it's in a skeletal muscle, as you can see here. Some drugs like aspirin, alcohol, that also lead to an increased lactate dehydrogenase 1. But the vitamin C decrease the lactate dehydrogenase 1. The vitamin C also decrease the lactate dehydrogenase 1. We focus on the lactate dehydrogenase 1 because we believe that the lactate dehydrogenase 1 that is a presence of the RBCs. Now I'm talking about the normal level of the lactate dehydrogenase, which is between 100 to the 190 units per liter. This is the normal for the adult, from 100 to the 190 units per liter, and molecular weight is 128 kilodalton. It composed of the 4 subunits. As we said, it's tetrameric subunits, and we said of 2 types. These 2 types is called H and M. It's also important that this enzyme contain zinc, okay, and it's important that is as a dehydrogenase. And again, we said there is 5 major isoenzymes. If there is a decrease of the key M, because we will discuss what is the key M, that is lead to the higher affinity for the lactate more than the pyruvate. Okay, so like we know that the lactate and the pyruvate, there are reversible reaction happened by this enzyme, but the lactate dehydrogenase 1 and 2, they have the higher affinity for pyruvate more than the lactate more than the pyruvate, but the DH4 and 5, they have higher affinity for the pyruvate more than the lactate. So again, lactate dehydrogenase 1 that is present in the heart RBCs, some lactate dehydrogenase 2 heart and the RBCs, but I said before, RBCs more in 1, heart more in 2, as against this drawing that I show it you here. Lactate dehydrogenase 5 in the liver and also the skeletal muscles. And when we said about the myocardial infarction, lactate dehydrogenase 1 more than the lactate dehydrogenase 2, we can say it's a flipping pattern. Okay, other information about this, that the lactate dehydrogenase 1, which is an increased in a case, dehydrogenase 1 increase in the case of the heart, that is rises in a 12 to 24 hours, and then it reaches the peak after the 48 to the 72 hours, and it will stay for 2 to the 3 days. And there is something, when I said when all the lactate dehydrogenase isoenzymes elevated, that means it's multiple organ failure, and it has a name actually. It's called Tempeston pattern. We have also in some resources they said lactate dehydrogenase 6, and is called alcohol dehydrogenase. The methods of measurement of the lactate dehydrogenase, because it's like a protein, so we do electrophoresis, immunological or chemical inhibition. And again, we said that is composed of the two subunits, H and M subunit. So we have to know also that it's reversed actions, but pyruvate to the lactate, it's faster. And the other things, like all these that we can say about the lactate dehydrogenase enzyme. We can say also the lactate dehydrogenase 5 is the most stable isoenzyme of the lactate dehydrogenase. So all this information about the lactate dehydrogenase, we just confuse in this part because they are said RBCs more in 1 and heart more in 2. And here the lactate dehydrogenase 5, which is present in the liver, that is stayed 14 days. Lactate dehydrogenase 1, which is stayed for 4 days. Myocardial infarction actually is used for the measurement of the heart, but normally it's lactate dehydrogenase 2, but it's okay. It's heart that is present in both of them. But the lactate dehydrogenase 1, if it's more than the lactate dehydrogenase 2, that is indicate that there is a myocardial infarction. And now we go to the alkaline phosphatase enzyme. Activity is present in most organs of the body. It seems to be actually associated with two things, with the calcification process in the bone and the lipid metabolism in the intestine. So alkaline phosphatase, it associated with these two things, calcifications of the bone and also lipid metabolism inside the intestine. As I draw here, the bone that is causes osteoplastic, in the case of the osteoplastic disease, it increasing the alkaline phosphatase enzyme. If there is a problem in hepatobiliary, that is also increasing the alkaline phosphatase enzyme. And we can say the alkaline phosphatase enzyme actually it's a membrane bound enzyme. That's why in the hepatobiliary disease that increases. Okay, and we have to know also the magnesium and the zincs are the cofactors for the alkaline phosphatase enzyme. Magnesium and zinc are cofactors for the alkaline phosphatase enzyme. So we can find it in the serum, or we can use carbonized plasma. Age dependency of reference interval, we discussed before the reference intervals. Before I talking about the activity of the enzymes, I will show some information about the alkaline phosphatase enzyme. But we have to know why it's called alkaline, because this enzyme works bestly or better in the alkaline medium. Phosphatase, because it's oppositely to the kinase enzyme, it removes the phosphate group D phosphorylate compounds, so the molecules diffuses freely, because if it contains a fuse, then it's that not move freely. So we have alkaline phosphatase enzyme. its best work in the alkaline medium. Phosphatase remove the phosphate group. Alkaline phosphate that is present on bone, liver, muscles, and kidney. Okay, so any diseases like Wilson or diseases that is lead maybe to an increase or decrease the alkaline phosphatase enzyme. So in the biliary diseases and cirrhosis, leukemia, Paget disease, hyperthyroidism, hyperparathyroidism, pregnancy, that is increasing the alkaline phosphatase enzyme. But in the case of Wilson disease or CML or hypothyroidism or postmenopausal, all of them they are decreasing the alkaline phosphatase. So in Wilson decreasing, in hypothyroidism decreasing. Hydrolyze enzyme, it's actually hydrolyze enzyme. The alkaline phosphatase, yes, is remove the phosphatic group, but it's hydrolyze enzyme, so we can say it's actually its calcification is 3, and it's activated by magnesium and zinc. It's useful in the diagnosis of the liver and the bone. Alkaline phosphatase and the AST. I mean, if the AST and ALT increase, because we know that these transfers are associated with the liver. About the isoenzymes of the alkaline phosphatase, it actually has 6 isoenzymes of the alkaline phosphatase. And these 6 isoenzymes, actually, we have alpha 1 alkaline phosphatase, and that is present in the liver. Alpha 2 alkaline phosphatase, that is present in the liver. Alpha 2 alkaline phosphatase, that is present in the placenta. Pre-beta alkaline phosphatase in the bone. Gamma alkaline phosphatase in the intestine. Leukocyte alkaline phosphatase, that is present in the leukocytes. So we have 6 forms of the alkaline phosphatase enzyme. Alpha 1 and alpha 2 alkaline phosphatase, that is present in the liver. We have also alpha 2 alkaline phosphatase. Okay, alpha 1 alkaline phosphatase, that is present in the liver. But the questions, we have 2 alpha 2 alkaline phosphatase, but one is stable and one is not stable. If unstable, then it presents in the liver. If it's stable, that is present in the placenta. We have a pre-beta alkaline phosphatase in bone. Remember, beta, bone. Gamma in the intestine, and leukocyte, that is present in the leukocytes. So again, alpha 1 alkaline phosphatase in the liver, alpha 2 alkaline phosphatase unstable in the liver, alpha 2 alkaline phosphatase stable presence in the placenta, pre-beta alkaline phosphatase in bone, gamma alkaline phosphatase in the intestine, leukocyte alkaline phosphatase, that is a presence in the leukocyte. Abnormal alkaline phosphatase isoenzymes, that is maybe increasing in a carcinoma and metastasis. The normal level of it's from the 40 to the 125 international unit per liter. It increases in the children. Why? Because of increasing the osteoplastic activity of the bone. So all these things about the alkaline phosphatase enzyme. Now we go to the activity of the enzymes. About the activity of the enzymes, we can say A plus B enzyme in the side that is to the C and D. A and B substrates are substrates, while C and D they are products. Activity of the enzymes is the rate which the reaction at which proceed, usually the quantity of substrates consumed in a chosen time. How to repeat the activity? The first thing by units of volume, other thing by the total protein, and finally by the catalytic concentrations. So, how we describe the activity of the enzymes by units of the volume measures the amount of the enzyme activity per unit of the serum, like activity per 100 milliliters, or we can say activity per 100 or liter of the serum, or activity per 1 milliliter of the packed erythrocytes, commonly used in a clinical lab to test the blood sample. The other measurements of the activity of the enzyme is the total protein. Reports enzyme activity relative to the total protein concentration in the sample, like U per mg of the total protein. Comparing enzyme activity in the sample with a different protein concentration. The other method is by the catalytic reaction, or we can say catalytic concentration. So we have the first one is the volume units, total protein, catalytic concentration. Emphasis the catalytic activity of the enzymes by the international units. U is the amount of the enzyme catalyzes the reaction of 1 micromole of the substrates by minute, per minute I mean. So we can say it's catal, okay, or Ca plus 1 mole of the substrates that converted per the seconds. And we just compare the different enzymes according to these studies. We have important, that is the measurements of the activity of the enzymes by first one volume units, total protein, and catalytic concentrations. Now we talk about the important parameters of these enzymes like a pH, the buffer, the temperature, the nature of the substrates, ionic strength, concentrations of the activators. Like the first one, which is so important in the activity of the enzyme, is the pH of the. It's associated maybe with the substrates, like what is the nature of the substrate, and maybe the presence of activators, or we can say cofactor, and some associated, or most of them associated with the environment of the enzyme, like a pH, buffer, temperature, ionic strength, and others. When we talk about something is called the Michels-Menten curve. As we can see here, we have this curve which is called Michels-Menten curve. Like it measures the absorption of the drug till it reaches the Vmax, and then it's not absorption of a drug that we are talking about, the activity of the enzyme till it reaches the saturation. So the Vmax like here, and this is half Vmax, and this is Km, and this is actually the Michels-Menten equation, which said that V, or we can say initial velocity, equals Vmax multiply the concentration of the substrates divided by Km plus the concentrations of the substrate. Km is the affinity of the enzyme to its substrate, and we can see from this relation that is the relationship between the Km and the affinity is inversely relationship between them. Once it increase the Km, that means the affinity of the enzyme to the substrate decreases and vice versa. And that is explain why acid lactate dehydrogenase 1 and lactate dehydrogenase 2, and I said they have affinity for lactate more than the pyruvate. They have low km. Actually, most of them has low km. Okay, let's refer back to the Michaels-Menten equation. It's important to know that the initial velocity equals V max multiply the concentrations of the S divided by Km plus the concentrations of the substrate. We have to know that the relationship between Km and affinity is inversely. That's mean the affinity, if the Km is low, that's mean the affinity is high. And if the Km is high, then the affinity is low. Another information about the Michaels-Menten equation, that all the enzymes are protein, catalytes, and specific. Okay, and we have to know that the rate is mean here speed, it means also velocity. So enzymes decreases the activation energy but not the overall change of energy of reaction. So the change of energy is constant while it decreasing the activation of energy. So decrease the activation energy but stable the change of the activation energy. They only catalyze one reaction. Okay, so another information also that kinase at phosphate, so we can say transferase, so it classified as 2, while phosphatase remove phosphatic group, so it classifies as hydrolase. Okay, let's back to the Michaels-Menten equation. When the substrate or when the enzyme binds to the substrate, then it makes a complex. It's called enzyme substrate complex. Okay, and then it's go till it reach the Vmax. So if set A equals P direct C, okay, that is not important actually. So how the equation can be happen, or how the equation, how they reaches to the Vmax multiply concentrations of the S divided by the Km plus concentrations of the S. It's a long equation, but it actually started with the initial V is directly proportional to the concentrations of the substrate, and then they see it equals constant but multiply by substrate, and this constant is called Km, and we called it Michaels-Menten equation or Michaels-Menten constant. But another thing that's so important to know it is that Vmax here that you see it in this equation, it's actually theoretical. There is, in the practical life, there is nothing is called Vmax, to be honest, because of this theory. That's mean if there is an increase the number of the enzymes, that's mean faster the reaction, that's mean it will become the Vmax greater. So in a human or in any organism there will be a large number of the enzymes, so it will be the Vmax will be greater and greater and greater. So in a normal life there is no Vmax, and that's why they just make a rule for the half Vmax because in practical it can be reaches to this, and they just know the rule or the equation of it, which is none that when the v, or we can say initial velocity, equals half Vmax, then the Km equals the concentrations of the substrate. And that's, I can say, all of something is called the Michels-Menten equation. All we have to know about the Michels-Menten equation, that is equals V max multiply concentration of the substrate divided by Km plus the concentration of the substrate. And when the initial V equals half V max, then that's mean the Km equals the concentration of the substrates. We have also to know that there is inverse relationship between the Km and the affinity. So if there is a reduce of the Km, so there will be high affinity of the enzymes to the substrate. If there is an increased Km, then that is lead to the reduce the affinity of the enzyme to the substrates. And we have to know that there is no in real life Vmax. Actually, we have half Vmax, we can say, because in increasing the number of the enzymes, that is lead to the faster reaction, that leads to an increasing the number the Vmax. So in a practical life, no one reach the Vmax. Okay, let's continue. There is something is called linked enzymatic reaction. Multiple enzymatic reaction are connected, and that's help the measure the activity of the first enzyme or the concentration of the substrate. Like these enzymes are connected to each other to produce a product which that facilitate the measurement of the concentration, or we can say activity of the first enzyme. There is indicator reaction. The first enzyme activity, that outcome of it to track or measure the activity of the other enzyme. Okay, so we have two reactions. We have linked enzymatic reaction and we have indicator reaction. Linked enzymatic reaction, like we use the following enzymes or we use the last enzymes of this reaction to measure the activity of the first one. Well, indicator reaction, we measure the first enzyme or we use the first enzyme to measure the following enzymes. That's why we call it indicator reaction. There is something is called rate limiting step, and that's important, and I said that before. Each cycle you learn, urea cycle, uric acid cycle, or whatever, you have to know what is the rate limiting enzyme. What does mean about the rate limiting enzyme? That's mean it's the first reaction in the chain, which is the slowest step in the sequence, and indicate how quickly the entire series of the reaction can occur. The rate limiting step, that's mean all the cycle depend on this step. And this step, it will be the slowest step of this cycle. So if this product come from this step, then it will be this is the last one to be slow. So we can predict how time or how long it will take this reaction. So you know now that the rate limiting step is the slowest step in the sequence. There is another enzyme is called gamma glutamyl transferase enzyme. originate from the hepatobiliary system. It's actually membrane bound enzyme. And in the case of the bilirubin, actually, I will talk a lot about the gamma glutamyl transferase. Okay. The other thing that I wanted to talk about these things, that is highest level in the renal tissue also. It's increased in all the liver diseases, drugs and alcohol. Remember, it's really an indicator of alcoholic patients, gamma glutamyl transferase. So if he drank like 0.75 grams ethanol per kilogram, that really increased the gamma glutamyl transferase. It's high organ specificity but low disease specificity. That's mean if it's increasing, I know exactly that this comes from the liver, but I can not know which disease he has. Now we talk about the pH and the buffers. In increasing the pH, that's mean alkaline, that's mean hyperventilation, because the hyperventilation we void or we can get rid of the CO2, which is acidic form, and that is increasing the pH, and vice versa. We have also Henderson-Hasselbalch equation, which is called pH equals pKa plus log um, conjugate base divided by weak acid, because we know that the buffer is compositions of weak acid plus conjugate base. So Henderson-Hasselbalch equation equals pH equals pKa plus logarithm conjugate base divided by the weak acid. So if we find that the pH less than pKa, that's mean the weak acid more. But if the pKa more than the pH, that's mean the weak acid predominates. Buffering capacity, it's the concentrations of the weak acid and its conjugate base. The criteria to select the buffer or create a buffer is a suitable pKa. There is no interference with the other reactions, suitable ionic strength, suitable stability and solubility, and there is none biological in nature. So this is what is good in the buffer selection, that is a suitable pKa, there is no interference with the other reaction, no ionic, not biological in nature, solubility and stable. And that's exactly, we can say it's the final of our lecture today. I can say more about the buffer system, but the most important thing that we have to know about the buffer system, that is composed of the conjugate base plus weak acid. Okay, that's what's so important about the piece. And by this we finish the third lecture of today.